Hello and welcome to my YouTube channel. Today the topic of discussion is anchorage. Anchorage is one of the most important subjects or most important chapter under orthodontics. So let's start with the definition of anchorage. Seeing that anchorage is a term which refers to the nature and degree of resistance. Now we see that it is a nature as well as a degree of resistance. Okay, to displacement offered by an anatomic unit when used for the purpose of effecting tooth movement. So going from the last, we want tooth movement, and then we see we are resisting the displacement offered by an anatomic unit. So there is an anatomic unit, we use the resistance offered by that anatomic unit to pull the other teeth. For example, I am using my maxillary molars, which has a greater anchorage or greater resistance to tooth movement, to pull my incisor teeth towards posterior direction so that I have my tooth movement done. So here the anchor unit which I use is the molars. Okay, they are resisting the tooth movement. Okay, I hope this definition is clear. The term anchorage refers to the nature and degree of resistance to displacement offered by an anatomic unit when used for the purpose of affecting tooth movement. Lastly, we need the tooth. I hope the definition of anchorage is clear to all. Now let's speak about the types of anchorage. In the types of anchorage, let's see the first type, simple anchorage. Whenever we speak about simple anchorage, there is the forces that we use are very less, and the second thing, the tipping type of movement is seen in these anchorage units. That is the basic difference between simple anchorage and stationary anchorage. In the stationary anchorage, usually there is a bodily movement seen, and the forces are directed in such a way that even the anchorage units move bodily. So this is the kind of forces which we use, and the forces used in stationary anchorage is higher. I am not speaking about the definitions regarding this because the definitions are more complicated. So I am just making it simpler to understand. Coming to the third type of anchorage, that is reciprocal anchorage. I think reciprocal anchorage is the simplest anchorage that we can understand easily. Reciprocal anchorage, when we speak, let's take an example of two maxillary central incisors, both of them sharing the same type of forces upon each other, acting upon each other in such a way that they close the space between them. They pull each other towards themselves. Okay, that is a type of anchorage that we see in reciprocal anchorage. Coming to the next anchorage, we speak about intraoral and extraoral anchorages. Intraoral anchorages, we use the anchorage units, the units in the mouth or the teeth as units or anything that occurs in the mouth. The anchorage units are in the mouth. And when we speak about extraoral anchorages, the anchorages are outside the mouth. We use appliances such as headgear, where we use the parts of the head or the bones of the head in such a way that we use them as anchorage units. Coming to the muscular anchorage, even muscular anchorage we use muscles, and it is also it's a intraoral type of anchorage. Reinforced anchorage, the other name that we give for reinforced anchorage is multiple anchorage type or something like that, because we use some more anchorage units in this. One of the example is Sweat's bite plane. We use reinforced anchorage in such concept because pallet is also used as an anchorage unit in Sweat's bite plane. Coming to the next one, that is, I think everything is intermaxillary and intramaxillary. Intramaxillary, we speak about anchorages within the jaw, intermaxillary between the jaw. The example for intermaxillary anchorage is Baker's anchorage. So types of anchorage we completed. Let's see what the literature says. It is defined as the point in the object at which the resistance to movement is at the maximum. So whenever I take an object, whenever I try to push that object, there is some kind of resistance that I have. The resistance may be different at different points in an object or in a teeth that we take. There are different, at every point there is a different kind of resistance that it produces. A teeth that is in the alveolar bone produces different kind of resistance wherever I place my force. So I want to know a particular point at which the maximum resistance is found. So when I use this point as my reference and I try to push my teeth using this reference, usually the tooth moves in a bodily movement. So that is center of resistance. Coming to the center of rotation, what is the definition of this? The point around which rotation happens. It is as simple as whenever I try to put a force over the teeth, there is some kind of rotation. Okay, so there is some kind of rotation that happens in this process. So there is a point around which the tooth revolves or the tooth rotates. So that point I term it as the center of rotation. Let's discuss the center of resistance for various structures. Coming to the first one, that is the single rooted tooth, I find the center of resistance 1/3 distance from the alveolar crest to the apex. If I draw a line from the alveolar crest to the apex, the 1/3 distance from the alveolar crest, I find my center of resistance there. Coming to the second point, that is the molars, I find it at the furcation area. Coming to the third point, that is the maxillary dentition, I find my center of resistance between the roots of the premolars. Even in the mandibular dentition, apical and between the roots of the premolars. If I speak about the maxilla as a whole, I get my center of resistance posterior superiorly to the zygomatico-maxillary suture or inferiorly to orbital also I can say.